Rob hasn't seen Dawn and Diane since last year. They're some of the healthcare assistants that looked after Rob's late wife Kath in her final months, both at home and in the hospice. Rob told us about a time she came in for help with symptoms.
She texted me or sent a WhatsApp to the group with me and my girls the next day of her sitting in bed with her cornflakes, reading a book, and she just said, "This is bliss." And I think that just sums it up, that it meant she felt very safe, she felt very comfortable, and that to me just means everything. You know, the fact that she felt safe and comfortable is all you can ask for.
But to keep supporting patients like Kath, the hospice now needs to raise £2,000 more a day. 2/3 of hospice care is funded through community donations, and the issues here are being felt in centres across the country at a time when the public have less money to give. The hospice says they've seen their energy bills rise by 185%. In real terms, it means they're now paying £6,000 a month for gas and electricity. This increase, coupled with rising prices overall, means the hospice now needs to raise £9,500 every day in charitable donations just to fund their services.
We would like the new Prime Minister to assess and review what hospices need to be able to get through these coming months and this turbulent time. That really needs sustainable and supportive funding, not end-of-life care being totally supported by bake sales.
The Department of Health and Social Care told 5 News the government has made over £400 million available to hospices since the start of the pandemic, and charities such as hospices may be entitled to a reduction in VAT. Dawn and Diana are heading out to visit a patient. Home visits make up about 80% of hospice care, so they're also being hit with high petrol costs.
If we're out and about and we see somewhere cheaper for fuel, we'll let the rest of the team know. And it becomes like a little bit of a game, really, because it's trying to see who can find the cheapest fuel as well.
We've got patients that are close by. We're happy to walk now, you know, because it's obviously saving fuel consumption and, you know, obviously costs to the hospice as well.
But there are some things that can't be cut back on, and right now many in the hospice sector feel hung out to dry. Emily Wither.